Advanced Cardiovascular System Block for 7th semester of medical school. This block aims to provide medical students with an in-depth understanding of the anatomy, physiology, pathology, diagnosis, and management of diseases related to the cardiovascular system. The cardiovascular system includes the heart, blood vessels, arteries, veins, capillaries, and their relationship with other organ functions. Below is a detailed outline of the topics typically covered in the Advanced Cardiovascular System Block. 1. Anatomy and physiology of the cardiovascular system. Anatomy of the heart and blood vessels. Heart structure, atria, ventricles, heart valves, mitral, tricuspid, aortic, pulmonary. Electrical conduction system, SAW node, AV node, bundle of His, Purkinje fibers. Major blood vessels, aorta, coronary arteries, vena cava, pulmonary veins. Physiology of the cardiovascular system. Cardiac cycle, systole and diastole. Blood pressure regulation. Renin-angiotensin-aldosterone system, ROS, and autonomic nervous system. Cardiac output, stroke volume, preload, afterload. Capillary gas and nutrient exchange, mechanisms of diffusion and filtration. Systemic relationships, interactions between the heart, lungs, pulmonary circulation, kidneys, and endocrine system in maintaining homeostasis. 2. Pathologies of the cardiovascular system. This block covers various cardiovascular diseases and disorders, including a. Coronary artery disease, CAD definition, blockage of blood flow in coronary arteries due to atherosclerosis. Manifestations, angina pectoris, characteristic chest pain. Acute myocardial infarction, heart attack. Pathophysiology, coronary artery endothelial damage, right pointing arrow atherosclerotic plaque formation, right pointing arrow partial, complete obstruction. Complications, heart failure, arrhythmias, sudden cardiac arrest. B. Hypertension, definition. Systolic blood pressure is greater than or equal to 140 millimeters of mercury, or diastolic blood pressure is greater than or equal to 90 millimeters of mercury. Pathophysiology, chronic vasoconstriction or increased intravascular volume leading to elevated peripheral resistance. Complications, left ventricular hypertrophy, stroke, chronic kidney disease. C. Heart failure. Definition, inability of the heart to pump blood effectively. Types, left-sided heart failure, shortness of breath, pulmonary edema. Right-sided heart failure, peripheral edema, ascites. Pathophysiology, reduced myocardial contractility or excessive cardiac load, high preload, afterload. D. Valvular heart diseases, types, stenosis, narrowing, or insufficiency, leakage of mitral, aortic, pulmonary, or tricuspid valves. Examples: mitral stenosis due to rheumatic fever. Complications: arrhythmias, heart failure. Arrhythmias. Definition: irregular heart rhythm, too fast, too slow, or irregular. Types: supraventricular tachycardia, atrial fibrillation, AV block, ventricular fibrillation. Causes: electrical conduction system abnormalities or ischemia. Vascular diseases, aortic aneurysm, abnormal dilation of the aortic wall. Venous diseases, deep vein thrombosis, DVT, and chronic venous insufficiency. Pulmonary hypertension, elevated blood pressure in the pulmonary arteries. 3. Diagnosis of cardiovascular diseases, a history and physical examination. History: chest pain, shortness of breath, palpitations, or edema. Physical examination: heart auscultation, murmurs, gallops, pericardial rubs. Pulse palpation, peripheral pulse abnormalities and jugular venous pressure, JVP. B. Diagnostic tests. Electrocardiogram, ECG, detects ischemia, myocardial infarction, or arrhythmias. Echocardiography assesses valve function and cardiac contractility. Laboratory tests, cardiac markers, troponin. CKMB, for myocardial infarction. Imaging studies, coronary angiography for coronary artery blockages. Chest X-ray for cardiomegaly or pulmonary edema. 4. Management of cardiovascular diseases. A. Non-pharmacological therapy. Lifestyle changes, low sodium, low fat diet. Regular physical activity, smoking cessation and alcohol avoidance. Surgical interventions, coronary artery bypass graft, CABG. Artificial valve replacement. B. Pharmacological therapy, antihypertensives, ACE inhibitors, enalapril, ARBs, losartan, beta blockers, metoprolol. Antiplatelet and anticoagulants, aspirin, clopidogrel, warfarin. Diuretics, furosemide for edema in heart failure. Inotropic drugs, digoxin for heart failure or arrhythmias. C. Emergency management, acute myocardial infarction, reperfusion therapy, PCI or thrombolysis. Nitrates and morphine for pain relief. Arrhythmias, defibrillation for ventricular fibrillation. Antiarrhythmic drugs such as amiodarone. 5. Practical training in the cardiovascular block. ECG interpretation, analyzing P, QRS, and T waves to detect abnormalities. Blood pressure and JVP measurement, practicing basic clinical assessments for hypertension or heart failure diagnosis. Cardiopulmonary resuscitation, CPR, managing sudden cardiac arrest. Cardiovascular case simulations, interactive case studies to develop diagnostic and therapeutic skills. 6. Psychosocial and ethical aspects, patient communication. Providing clear explanations about prognosis and treatment options. Ethics in cardiology. Approaching patients with terminal illnesses or severe heart dysfunctions.